And good morning. It is April 20th, 2023. I'm Dr. Ara Duke-Majan. I'm here with my team at Duke Spine Institute, Surgery Center Vieira. We're getting ready to start our first surgery. This is a patient who comes to us with neck pain radiating from the neck into the shoulder on the right side. And he's had this pain for how long?
He's had for a year total, 8 months acute.
All right, so over the last year, it's gotten worse. For the last 8 months, it's been very bad. And you could see on the MRI, there are really two main disc herniations. One is at C6-C7 at the bottom there. It's quite large, and it's off to the right side. The other is at C4-C5. So there's actually a disc in between C5-6, which is okay, and we're going to fix the C4-C5 and the C6-C7. We're going to need 2 incisions for this surgery. Each one is 4 millimeters. Just so you can orient to what's going on, the patient is laying on their back looking up at the ceiling towards the camera. The tube that goes down into their lungs, the endotracheal tube, is right about there. The eyes are here, mouth is here, and the chin is here. So we're going to get started, and the surgery that we're going to be performing for these herniated discs in the neck is called the Duke laser disc repair. The Duke laser disc repair is a minimally invasive surgery. The light just shifted a little bit because of the IV pole. If you could tilt it back towards us. Perfect. A little bit more, just right here. Great. Thank you. Yeah. All right, so we're going to get started. Now, what I'm going to do, what I normally do when we have 3 discs in a row, I'll put the needle in at the middle disc and then move my way up and down throughout the surgery. Because we have discs separated by a great distance, we're just going to do 2 separate needles, okay? So we're going to get started right now. I'm going to place the first needle. To do this, I'm going to use my fingers, specifically these 2, okay, to displace the trachea and esophagus medially, we call it medially, or to the other side, and the carotid sheath and its contents the opposite way. So there's a small little gap. It's about 1 millimeter wide between the trachea, esophagus, and the carotid sheath, okay? So trachea and esophagus, carotid sheath, and I'm going to spread it apart and put this needle in. All right, we're going to use fluoroscopic guidance to do that. I need to feel the spine, which I'm doing right now. I feel like a little bone spur right there. I'm wondering if that's 6-7. So I'm going to put my needle. I'm not going to go through the skin yet. I'm just going to place it and see where we are. All right, Jordan, we need to do better than that. I need to zoom out a little bit. 2, 3, 4, 5, 6, 7. You agree that's 6-7? Okay. You guys see what I'm doing here? 6-7 shot. There it is. Get an AP view. I want to make sure my needle is centered over the center of the front of the spine. We're going to look for the spinous processes to tell us that. All right, we're just a little bit, it is actually centered. If you look at the tip of the needle, it's running off. We could probably push just a little bit more towards the opposite side, but it looks pretty darn good. Shot. All right, now I've lost the needle. I need to spread my fingers again and see if I can find it. Shot. There it is. All right. So I'm going to go down to the spine. Shot. And I'm actually touching the front of the disc at this point. Let's get another shot. AP. Make sure we're in the middle. The front of the spine, if you understand the anatomy, right in front of the spine, there's a ligament that runs down the front of the spine in the center. It's called the anterior longitudinal ligament. Turn the fluoro a little bit. You're not seeing the tip. I need you to see the tip. That's not the issue right there. No. Why would you do that? How do you think you need to turn the fluoro? No. I mean, it's like a no-brainer. Yeah, that's exactly what you have to do. The other way of moving it, you're actually shifting the midline, right? You don't want to shift the midline. I can't see. Back to a lateral, please. Anyway. Sometimes my staff just has to steal my attention. long story short, there's a ligament in front of the spine, and it's called the anterior longitudinal ligament. 2, 3, 4, 5, 6, 7. All right. So we're where we need to be. Let's get an AP view. Kind of like a little child that has to be heard sometimes. These babies just cry, so they want attention. Perfect. You can see the midline. I'll give you a chance to redeem yourself, Jordan. Get on there with the arrow. Show us the midline. Yep, there's the midline. All right, where's the esophagus? There's the esophagus and the trachea. Very good. All right. Let's go to the next one. It's going to be the number 4, 5. 2, 3, 4, 5. All right. So while we're doing this second needle, let's go ahead and show the audience a video of why do disc herniations cause pain in the neck in the first place? What's the mechanism by which they do that? Look how far apart these two discs are. Just to give you an idea, there was no way I was going to be able to get both of them through one incision. All right, AP. See that, guys? Well, I'll show you better in a moment once we get this in place. I'll show you just how far apart the entry points are. That's good. See? Now you're getting it. All right, we're pretty much in the midline, slightly off to his left, which is my side. See how I've displaced the trachea and esophagus there? Hold on. And shot. Yeah. Shot. I think I want to be a little bit more north. Shot. That's good. Shot. Let's get a AP. Hold on. Let's get an AP. Let's see. Shot. I just flipped the needle. Let's get an AP now. We use the front, back, and side-to-side x-rays to get an idea of where we are quickly. That looks good. Let's go back to a lateral view. You can see the other needle is perfect in the middle at 6-7. This is the 4-5 needle. Everyone agree? 2, 3, 4, 5. Something is firm there. That's a bit unusual. Could it be the annulus? Oh, that's probably just the annulus. We're through the annulus now. I can feel we're inside the disc. Shot. All right. So let's pause for a moment. You all see the two needles. One is at 4-5, the other one is 6-7. Look how far apart they are. There was no way I could do it through one incision, so I had to do two. Each incision will be 4 millimeters. You can see the trachea and esophagus right here, kind of making a lump. You see that? And the carotid sheath is right over here. I could feel the carotid artery pulsing. Okay. All right, so we're going to do a discogram next. So the stages of the surgery include, getting the patient intubated, prepped and draped, positioned. Then we do our placement of the spinal needles anteriorly into the proper discs, which you guys can see. Let's count for everybody on the lateral x-ray, Henry. 2, 3, 4, 5, 6, 7. So we're at 4, 5, and 6, 7. Now we're going to do our discogram. We want to see the tear in the back of the disc where the herniation has come out. And shot. Very good. One more shot. Good. One more. All right. So show us the tear. Show us the herniation. There's the tear. It's the black stuff in a tear. And then the herniation is there. There's another herniation. So you can see two herniations. Show us a nice, it's probably gone by now, the dye, but show us on that picture the first herniation on his left. It's a smaller one. Yep. And now show us the bigger one. There it is. That's the bigger one. You guys see that? That's on his right. So you can actually have a double shadow because there's two herniations, one on the right, one on the left. And the bigger one is on the right. Now we're going to do the number 4-5. This is a smaller herniation. I don't expect it to be that big. And shot. Well, there it is. You can see the herniation. That's the beauty of the discogram. It shows you the tear, and there's the herniation. Sorry, let's go again. First the tear, now the herniation. So the herniation, what you're seeing is a black shadow around it. It's kind of sticking out there in the epidural space. Perfect. At this point, we're going to start with 6-7. I'm going to take my stylet and put it back inside the needle at 4-5, and we're going to leave that thing alone. Okay, we're going to come back to it. I am going to push it just slightly further, just a few millimeters, so it gets out of the way. It's perfect. Now we're going to go down and start our surgery down at 6-7. Any questions? Did you play the video?
Not yet, and no current questions.
All right, go ahead and play the video.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. Now you know why disc herniations cause neck pain. It's the tear in the back wall of the disc called the annular tear. It's in the posterior wall. Shot, go ahead and take the guide wire out. We're now entering the 6-7 disc with our dilator. And you could see the offset orbitally on the back of the C6 vertebral body. But it's okay. So I'm going through the jelly part of the disc, which is not being harmed at all by the dilator. Now I'm inside the annular tear. I could feel it. I'm inside the herniation. Okay. We're going to do the whole surgery through this little tube right here. You see this, Henry?
Yes, we do.
And by the way, the amount of radiation we use with our X-ray machine is much less than spine surgeons use for fusions. If you're having an artificial disc or a fusion done, which is an invasive surgery, this is the surgery that would replace those surgeries. It's a newer technology, much better. And patients get exposed to a lot less radiation with this surgery. The amount of radiation exposure from the X-ray machine during surgery with fusions is much higher. And the reason for that is, of course, you have to check your hardware as you're putting it in. There's not just the navigational X-ray and the localization X-ray, but you have the placement of hardware into the spine X-rays, which are required to watch every screw go in. Shot? So the dilator is getting pushed out by the pressure within the disc. Shot? Yeah, you guys see that? The dilator is literally being pushed out by inflammatory pressure. So there's a lot of hydrostatic pressure inside this disc. Hydrostatic comes from the inflammation inside the back of the disc, shot? And that inflammation is literally pushing this dilator out, back up the tube, saying we don't want you here. It's under so much pressure. That's not normal. It's abnormal to have that kind of pressure. All right, as you can see on the x-ray, Jordan, show us the endoscopic tube. Yep. And show us the disc, front to back, back to front, that's fine. So where's the back of the disc, Jordan? Right there, good. And the back of the disc is supposed to line up with the back of the vertebral body. Show us the back of the vertebral body. There you go. So we want to dock our tube right within the annular tear at the back of the disc where the herniation is. So we can get the herniation and we can get the annular tear. Let's get started. Any questions from the audience?
No current
Push that
questions.
other needle. Don't let it get pushed in at all. All right, we're going to get started using the endoscope. And this type of surgery you're watching is a type of endoscopic spine surgery. But there are many different ways to do endoscopic spine surgery, just like there are many ways to do fusions or artificial discs, many different implants, many different techniques. In the end, this is endoscopic spine surgery, but it's a specific type that works very well at curing back and neck pain, unlike other types of endoscopic spine surgery that don't. We were the first to do this at Duke Spine Institute. We pioneered this technique, and I started doing it 16 years ago. What is 16 years ago? It's like 2006, right? What is that? 16 years ago. 23 minus 16, 2007. So I guess I've done it now 17 years ago. All right, here is the tear. That white is annulus. That white is annulus. They used to be connected, but this patient had a trauma which caused a tear. And then the blue stuff, which was normally up here inside the disc, pushed out through the tear. And that's called the interposed herniation, extruded disc, whatever you want to call it. But it's a type of herniation that's stuck in the tear, in the wall of the disc. Nobody ever talks about it. Surgeons don't pay attention to it. Nobody pays attention to it. But it's the most important part of the herniation. And we've been talking about it for 16 years now at Duke Spine. Because that's the part of the herniation, it looks like a stalk of a mushroom. It's the part that causes the neck pain. And if it happens in your back pain. And if it happens in your thoracic spine, your thoracic pain. The point is, this tear is the source of back pain, neck pain, when it comes from a herniated disc, which is the most common form of back and neck pain. Pain from a herniated disc. It's about 85% of all neck and back pain. We're in the process of studying what the causes of neck and back pain are. We're going to be done with our data analysis soon, and we're going to publish. There's a herniation right there. So if Victoria and Azdul are watching, welcome to our live stream, Azdul and Victoria. The blue stuff is the stalk stuck in the annular tear right there. And I'm cleaning that with a laser. Okay? Then when you get to the part that's outside of the disc, that's way down there. It's already outside of the disc down there, and it's pushing on the spinal cord and nerve roots. Okay? So the point is that this blue stuff is not one piece of herniation, it's many. It's many pieces of herniation. Sometimes it's one big one, and many times it's many pieces. I'm going to flip my scope around, and I'm going to attack the other side. Okay? There's another piece of herniation. See that right there floating up? That's what I mean. They're all irregular shapes and sizes. Their surfaces are even different. Some of them are more recent, so they're more fibrous, like they have little fibers like that. And some of them are older and they're smoother. So they have a smooth surface. Those are the older ones. And there's scar tissue in here, Azdul. In this wall right here, it's not just annular tear, but there's calcium, little calcium deposits. That would be good to show as well around the scar tissue or in the scar tissue. So when you do the scar tissue for the model and you show little islands of scar tissue inside the annular tear wall next to the nuclear stalk, when you show that, put some little flecks of maybe green. No, not green, calcium, what color? Maybe orange. Why not? It's the orange stuff you're seeing there, so why not keep it orange? There's the posterior longitudinal ligament. You all see that? Those fibers right there running left to right, that's really running up and down. And we call that the PLL, or posterior longitudinal ligament. And look at the, I think that's a tear as well, or the foramen. Look at that. See the herniation down there? Moving and jiggling? There's a few pieces that just, there's 3 pieces. So 3 pieces just came out of that hole. Those are pieces of nucleus pulposus. That's basically your herniation. And they were way down there where they shouldn't be. They're out of place. People ask me all the time, can you put the herniated fragments back? And the answer is no, because they've been damaged. After they came out, they've been chemically altered, basically, for lack of a better term. And they're no longer normal. So there's your herniation right there. It tore through the annulus. Okay, there's the bones on both sides, left and right, called the end plate. And you can see the herniation is going past the bones, past the end plate, past the vertebral body into the epidural space, where it should not be. I'm getting a lot of water. God damn it. This cutting the bag thing is not working. It's just pouring water.
This is actually a smaller bag.
I don't know. It's just, it's getting all over my shoes. I don't know. I don't know why it's failing, but it's clearly not the fact the suction isn't on.
Is there anything in the canister? Is there any fluid
All
in
right.
the canister? Okay, good. We just gotta figure out why it's not all the train. It's not keeping up with it.
All right. Sorry about the interruption there. But when you have ice cold water dropping on your foot during surgery, it's a bit distracting. All right. Good news is that water evaporates. By the way, that's something that I sort of laugh at with this whole green earth stuff. And all you got to do is pull this up.
Yeah,
See
yeah,
this?
you just,
Yeah, do it.
manual, but
Yeah, just pull it
I
up.
don't wanna be
Yeah, pull it up.
the fire.
This green earth stuff about water, everyone thinks water is, it is a precious resource. See, it has nothing to do with that. The problem is it's somehow getting around. It's coming here, that's why, here. It's coming here. It's coming here and missing the bag completely. Okay? So this little bag sucks.
Yeah,
Don't do it again.
Yeah, I know. It's just the other one is back order. That's or
Back order.
yeah. Bad.
These fuckers.
I know. I'm sorry, sir.
The lying sacks of shit is what they are. Find another supplier. This bag is not acceptable. I'm not going to sit here and have my feet get wet every single surgery just because you guys got to find a different distributor.
Yes, sir.
Go find someone else other than McKesson.
Yes, sir.
All right, any questions?
No current questions.
So, a couple of things to talk about. One of them is the fake shortages that pharmaceutical companies, I just can't do this. How much is this bag?
Probably like a $4 or $5.
So put 2 of them, one here, okay? I mean, you know, it's too late for this, but you gotta, this is unacceptable.
It's okay. No.
So pharmaceutical companies and manufacturers we're in an era now where they do unscrupulous things. They fake shortages. And the reason they do it is they can raise their prices when they fake a shortage. So who gets hurt in the end is patients, right? Fake drug shortages. And the best example of this, if you don't believe me, I don't care. But the best example of it is Enron. For those of you who remember the Enron company that went belly up, they went belly up because of all the fraud they were committing. They were committing fraud, okay? And you have to go back and study Enron to understand. But Enron would fake energy shortages in California. They would lie and say that the reactor's down, they don't have enough energy, and guess what? They would raise the price. That was the only way they were allowed to raise the price. The regulators in California, the government would say you cannot raise the price of energy too high unless you have a problem with your reactor, your nuclear reactor's gone down, and you have repairs to make. Then you can raise the prices, okay? So they would literally fake that the reactor went down, lie about it, tell the public the reactor went down, shut off the energy, and they would raise the price 10 times higher than what it normally was for energy in California, okay? And they got caught lying. They got caught. They have videotapes, audio tapes of the conversations with the supervisor of the nuclear power plant saying, shut down the reactor, and we're going to shut down the reactor and raise the price. So they got caught, criminal investigation. I don't even know if they went to jail. I doubt it. But the point is, folks, these companies lie to you. They lie to the public, and the government does nothing to stop it. So we have fake shortages of medications, fake shortages of supplies. Hell, there's fake shortages of supplies to build homes and new buildings today. They fake shortages of air conditioning equipment so they can jack the price up, okay? It's completely not the America that I grew up in. It's shameful and disgusting. These are bone spurs, by the way. So the reason why it matters and we're talking about it is because it affects us here in medicine. Hospitals have drug shortages, and they say their drug shortages are because there's a lack of supply of the drugs. They can't get it. The reason they can't get it is because the pharmaceutical companies are faking the shortage. Okay? So it affects everybody. It's not just something you complain about, it's real. And it has real life consequences. And unfortunately, our government is like completely incompetent and unable to stop it from happening when they should be regulating it and helping us to avoid these fake shortages.
Dr. Duke, I'm switching over to yours.
Thank you.
Thanks. But it's a bit aggravating because here we are trying to provide the best care in the world to our patients, and we're limited by this horribly dishonest business practices of companies lying about shortages that they don't really have, just so they can make more money, okay?
Same thing with homeowners insurance. They don't go by historical data for flood insurance, so they just go by all the other floods that happen around
Yeah,
the
there's
state.
this is a corruption of the ideology, and it's pervasive throughout society now. And
They don't use historical.
it's literally the Dark Ages coming back again. And I always say that. We're degrading our society back to the Dark Ages. It's taken us millennia of time to learn to live together socially, okay? Human beings are not evolutionarily designed to live together socially. We're designed to compete with each other, kill each other for resources, okay? That's what the cavemen did. That's what we did for centuries in Europe, right? Fighting. We called it holy wars and whatever you want to call it. But in the end, it was all about money and resources, food and gold and whatever things of value. Women, men, I don't mean to be sexist here, but it was literally about, assets, resources, who gets them. And there's not enough to go around for everybody. So you have to manufacture wars and fights and people killing each other to get those resources. Now think about that. If we had just a fraction of the population of the world 2,000 years ago and people were killing each other for the resources that were available, now we have 10 times the population of the world. What's going to happen? as we have moral decay, social decay. What do you think is going to happen? Why do you think they make movies about zombies? Those aren't real zombies with a virus. Those are us. Those are us when all social etiquette and rules get thrown out the window. We become those zombies. The reason is because, frankly, to be quite honest, the zombies' focus is food, right? And where is their food source? Human beings. Where do you think our food source is going to be when society collapses? When you have 40 million people living in Mexico City that suddenly have no food source because all the infrastructure, the semi-trucks delivering fresh vegetables and food to the city evaporate overnight because of chaos. Where do you think the food source is going to be? Think about it. Anyway, the only thing that will save us is getting back to decency, humanity. Basically, honesty, integrity, caring, compassion, helpfulness. I call them Christian values, but other religions have these values too. It's not just Christians. So it's not unique to Christians, but that's how I was brought up, so I refer to them as Christian values. But Christian values are truly what allow us, and there are Muslim values and Islamic, obviously, values and Israeli values, and all these religions teach the same thing: respect, caring, honesty, integrity, and that allows us to live socially, okay? Successfully socially. But if you throw all that stuff out the window, then we're going to fall into social decay, and people are going to be eating each other in the streets, trust me. I can see it already happening. You cannot have billions of people living together socially without rules that people actually follow. And as we see governments no longer willing to enforce rules and laws, people are expected to do it. No, we're not allowed to do it. So that's really, we're heading in the wrong direction, folks. All right. And you're seeing little snippets of it with things like manufactured shortages of drugs and supplies for healthcare, and nobody's stopping it. Healthcare has always been that area in society where nobody wanted to mess with, you know? It's always been somewhat protected from these other economic algorithms and strategies and forces. But now we're seeing shortages of drugs, supplies that are needed in healthcare, staffing, nurses, medical assistants, you name it, huge shortages. Why? Again, manufactured. Okay? Unfortunately, manufactured by a lot of different variables, but I won't go into those details. Any questions about the surgery?
No current questions.
All right, we're at the back of the disc here at 6-7. I'm looking for any more herniation. I don't see it. That's scar tissue right there, just a little bit. And I have to be careful because just under it is the spinal cord. You guys see that right there? That's literally the spinal cord. And you can see the red stuff, inflammatory stuff right there. Okay? So clearly there's been inflammation going on here. And that inflammation is because of the herniation. But we're now at the back of the disc, and I can see the spinal cord behind what's left of the posterior ligament. I'm inspecting everything. I don't want to leave any herniation here. Now, people talk to me about the herniation and getting an MRI. There's the nerve root right there. You guys see the nerve root right there between that little piece of ligament? So, do we take 100% of the herniation out? No, we don't. We never do. It's impossible. Look at all these tiny little fragments here. Okay, so no matter what surgeon you are, no matter how good you are, whatever technique you use, you're never going to get 100% of a herniation out, ever. And you don't need to. That's the good news. You need to get 50%. If you get 50% of the herniation out, then you're going to give that patient excellent relief from the herniation. Okay, but the important thing, and we're done here, the important thing, there's another piece of herniation, is that we debride the annular tear, which is where the pain comes from. All right, let's run the video so the audience can see what exactly does the Duke laser disc repair do.
You got it?
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back, and hopefully you've learned something through the video we just showed you about how the laser clears out the annular tear and removes the inflammatory tissue, calcium deposits, scar tissue, herniated fragments stuck within the tear to allow the tear to heal. The Duke laser disc repair surgery you're watching is the first in the world to do the annular debridement, and we're the first to publish it, and this is done with a laser. There may have been somebody else who did something similar in the past with bipolar, but bipolar doesn't work. The laser is the way to go. All right, that's why it's called the laser disc repair. I want to show you the tube. We did the whole surgery at 6-7 through this 4mm tube. I'm going to remove the tube. Here you go. We're going to use it again in just a minute. Again, we're on the patient's left side of their neck because I have to choose one side or the other to get to the disc. You can't go down the middle. If you go down the middle, you're going to go through the esophagus and trachea, and the anesthesiologist will not be happy about that. Neither will the patient, because they won't be able to eat or drink for months. They'll have to have a feeding tube, and they'll have all kinds of airway complications. So spine surgeons approaching the cervical spine through the front either choose the right side or left side, and that's standard. That's not unique to our surgery. So we have to make a choice. Do we go on the right or left? And the way we choose is based on which side the patient has the worst radiculopathy, which is pinched nerve symptoms or signs. All right, there's the incision. You all see that?
Yes, we do.
And by the way, this is a bloodless surgery. This is how much blood we've lost. 2 drops, maybe. So that's another nice thing about the endoscopic procedure is we don't lose blood. Whereas open surgery, you're going to have bleeding, and you're going to lose quite a bit of blood, potentially, if you have a bad surgeon. All right, shot. There we go. So we're going to do the 4-5 next. I'm going to start by taking my stylet out, guide wire in. We're going to check the position of the guide wire on the x-ray. It's perfect. We're inside the disc. I'm going to remove. Oh, yeah, I'm going to make the incision. Thank you, Luis. We're going to use a number 11 blade. This is an incision. This is not a percutaneous surgery. Percutaneous means it's done through a needle. Some people say percutaneous means done through the skin, but all surgery is done through the skin, isn't it? Unless you're operating on the skin. But all surgery is done through the skin. So percutaneous is really needle-based surgery. Okay, shot. You got to watch your dilator tip and your guide wire tip both. Shot. All right, we're heading down towards the disc. We're going to be at the front of the disc now. I feel it. We're at the front of the C4-5 disc. We're going to check our position on an AP view. I'm using a coker to hold it so I don't radiate my hands too much. Perfect. So you can see we're in the middle of the spine. Now we're going to get a lateral view. I'm going to use the lateral view to guide my entry. People ask me, when you go through the front of the disc, don't you damage it? No, we don't. The front of the disc is fibrous. It has fibers. And the nice thing about fibers is that they spread apart. And then when you're done, they come back together. Think about when you put a pin in your clothing. When you put a little safety pin in your shirt or your pants, does the safety pin destroy your pants or your shirt? No. It literally pushes the fibers of the material apart, does its job, and then when you take the safety pin out, the fibers come back together. There's been no damage whatsoever to your clothing. Same thing with the disc. You have a fibrous part in front, you have a jelly part in the middle, and the metal instruments don't hurt either because they're small enough not to hurt them. Shot? Okay, we're going to do the same thing here. We're going to advance the tube through the disc. We call this an anterior because we're coming from the front. Transdiscal, we're going through the disc. That's what transdiscal means. And look how the dilator was popping back in again. Just a little bit of vibration and it gets pushed out. I got to try to get it to stay. Getting it to stay requires a special technique that I developed, Shot, where you basically trap the dilator with your impact sheath, which is this one, and you don't let it back up. But you got to be careful because if you trap it too much, you can drive it forward into the spinal canal. You don't want that. All right, now if you just advance your tube without a dilator, you're going to biopsy the disc. We don't want to biopsy the disc. We're not trying to do a discectomy. We're trying to do an annular debridement and a herniectomy. Anybody know what a herniectomy means? It means remove the hernia, the herniated pieces. That's it. Herniectomy, annular debridement. There's the other incision. You all see that? Nice, huh? Any questions?
Yes, we have a question from Sean on YouTube.
Starting to wonder, maybe nobody was able to ask questions.
No,
Go ahead.
The question is, what is your opinion on artificial discs?
Great question. What is my opinion on artificial disc? Well, I've given my opinion, to be quite honest, in several YouTube videos, which you can find on our YouTube channel at Duke Spine. However, I will answer the question. If you look at the evolution of treatment of joints that are painful in the history of orthopedic surgery, such as hips and knees, and you understand that painful hips and knees have been around since human beings have started to weight bear and walk around, right? I don't know what this is here for. I need to move the laser. Now you can put it there.
Okay.
Yeah, that's fine.
Keep the water.
Yeah, I understand, but I got to first do that. So look at that. Look at that granulation tissue right there. You see it, the pink stuff? See the pink stuff? I know it's kind of hard to see it, but
We see it.
it's very faint, but it's really not faint. It's just the camera. So if you go back to the history of treating painful joints, like hips, that's a fragment right there. There's a herniation. I don't know if Azdur is watching, but Azdur, you can see what a herniation looks like. There's literally 20 or 30 of them in here for each disc. Right? There's another one there. And basically, herniations are not one piece that comes out. It's many pieces over many period of time, like years. And in the beginning, you may get a herniation piece or 2 or 5, and the patient has no symptoms at all. They don't have any pain. They don't even know they have a herniation, okay, for years. And then as the amount of herniation gets bigger and bigger, as more pieces come out, then the herniation gets bigger. and it becomes more symptomatic usually, but you can even have small herniations that are symptomatic. Okay, there's another right there. You see that? I hope
Yes, we
Azdul
do.
is watching. Is Azdul watching? Did he comment?
No comment. I can't check if he's watching.
Well, Azdul, if you're watching, give us a hello on YouTube or Facebook as we're broadcasting live on those platforms, or LinkedIn. Anyway, the piece is too big to get out. It's stuck in there. So I'm going to go and grab it. But let me get back to answering the artificial disc question. So for years in the beginning, the way surgeons figured out how to help people that had horrible pain. Let me show you the herniation. Lights on. Henry, take a look over here. Okay. See it?
Yes, we do.
For many years, people with painful hips and knees, the surgeons would fuse their hip and knees, fuse them. And by fusing the painful hip and knee, you took away the pain. But the person lost the ability to move their hip and knee. And they had a straight leg. And I've seen people like this, by the way, in my clinic. I didn't do the surgery, but they had it done many years ago, and it's horribly debilitating. Literally, they have a straight leg. They cannot move. It's horrible. And it creates all kinds of problems. So, anyway, long story short, surgeons figured out, hey, why don't we get rid of that painful joint, but let's not fuse it. Let's put a metal knee in there, or a metal hip. And so they were able to get rid of the painful joint by cutting it out, but then they put a metal joint in there to take its place. And what the metal joints did is it allowed the knee to be flexible still, or the hip to be flexible, okay? There's another piece of herniation right there, Azdul. I hope Azdul is watching. Anyway, I'll send the video to him later if not. So it was definitely an improvement to make artificial hips and knees, because the alternative of fusing the hip and knee was horrible. Well, then they took this technology and applied it to the spine, okay, painful discs or painful joints. And the problem, though, is that to get to the spine, you got to go through the belly for the lumbar spine. And going through the belly is the most dangerous surgery you can do when you're dealing with spine problems. You want to try to go through the back, not the belly. But nobody has developed an artificial disc through the back. That's one problem, okay? And I don't think they will. Not anytime soon. So you got to go through the belly. So it's the approach to the spine that's very dangerous, and I do not recommend it for that. Then again, you also have other problems. The artificial discs pop out, okay? They pop out, and people are constantly complaining that they don't work. So I'm a big believer in the patient experience. If patients were coming to me saying, oh my God, the artificial disc is amazing, 100% of the time, which they don't, then I would say, wow, the artificial disc is a good thing. We don't need to do anything else. It works. It works in everybody. So the fact the artificial discs really don't work is why so many surgeons still do fusions. Plus, they get paid more for fusions. So there's two reasons why surgeons do fusions and not artificial discs. Commonly is, number one, they make a lot more money with fusion, and number two, the artificial discs just don't work and they're dangerous to put in. So I guess three reasons. I'm a believer in the same. I don't believe artificial discs should be put in, because whether you're going in the back, you're going in the neck, they're dangerous to put in and they pop out and they don't work. They don't get rid of the patient's pain most of the time. They fail, okay? And they also cause adjacent segment disease, which they told us they wouldn't, but they do. So what's better than artificial disc infusion? Well, you're watching it right now. This particular surgery is the best. And there's no metal being put in your spine. Why would you want metal in your spine? There's no reason to put metal in your spine, except to make the companies money that manufacture the metal, and to make the surgeons money who put it in. I was a metal surgeon for many years. I put in thousands and thousands, literally 10,000 screws I put in to people's spines over 26 years. Okay, and I was also doing the endoscopic surgery, and I started asking myself, why am I doing these fusions when the endoscopic, this surgery here, works? And it's so fast to recover. People go back to work in a day. They can travel in a day. Their pain is gone immediately. It stays gone. So the results of this endoscopic surgery are far better than fusions or artificial discs. The results of this surgery include not having to take narcotic painkillers. If you do a fusion or artificial disc, your doctor is going to prescribe you narcotic opioid painkillers. You're going to be on them for months. With Duke laser disc repair, there's no narcotics, no opioids. It's Tylenol for one night. That's it. Tylenol. You take Tylenol for one night. The next day you're done. All right? Yeah, thanks. So there's no reason to do artificial discs. There's no reason to do. Let me ask you a question. Let's pretend for a moment, I don't know how old you are who asked the question, but there's something called a payphone, which some of us know what a payphone is because we grew up with payphones. A payphone is this phone that's found usually at grocery stores or gas stations, and you put quarters in it and you can make phone calls, all right? And the telephone companies used to put them everywhere so that people could make phone calls. Like if you were driving somewhere and you need to make a phone call, you stop, you get gas, and while you're getting gas, you make a pay phone call, right? Then somebody discovered cell phones. Now that we have cell phones, you don't need a pay phone anymore. So if you ask me, why don't you do artificial disc, it would be like you have a cell phone, an iPhone 12, and why would you pull over on the highway to make a pay phone call? It makes no sense. It's just, there's no reason for it. It's unnecessary. So payphones are gone now. You can't find them anymore. You know, there must be a payphone graveyard somewhere. But these are all pieces of herniation, by the way. Right here is another one. The point I'm trying to make, though, is very simple. Is when the technology advances to the point where you don't need the older technology anymore, which is where we are, by the way, and we've been here for 16 years since I've been doing this surgery, it's unnecessary to do fusions and artificial discs anymore. Period. There is absolutely never a need for a payphone when you have a cell phone. And there is never a need for artificial disc with this surgery. The problem is surgeons don't know how to do this surgery. And they're not going to get paid very well to do the surgery. So they're not motivated to learn. I've given talks on this surgery all over the world. Hong Kong, all over the United States. I've been invited to speak and talk and share the results, which I have. And surgeons love it. They come to the talk, they're like, this is so cool, but then they realize there's no payment for it, and they don't want to do it. There's no money. They don't get paid. I had to do this without getting paid for about 10 years. 10 years not getting paid. But I did it because I wanted to learn the technique, perfect it, and then eventually publish it, which we did, so that other people could learn about it and we can do it. So now we're doing it. I don't get paid much for it. I get paid a lot less to do this than I do fusions. But it's better for the patients. They love it. And that's why I went into medicine, was to help people, not help myself. So truly, doctors that care about patients' well-being and put that priority as number one, they're going to do this surgery and not fusions if they can avoid it, okay? There are going to be cases, rarely, where fusion is necessary for whatever reason, whether it's financial for the patient that can't afford the laser surgery or the insurance won't cover it or whatever, okay? But it's not going to be for what's best for the patient. This is what's best for the patient. That's why this patient's here getting it done. All the people you watch me do laser surgery on, we could have done a fusion. Okay, we could have done a fusion. And I would have gotten rid of their pain. But the fusion is so invasive and unnecessary, there's no reason to do it. And I won't do artificial discs anymore. There's too many bad results. Okay, the people that are promoting artificial discs, if you want to know the God's honest truth, they're doctors. There's a big herniation right there. They're surgeons that are making money one way or the other from the companies that manufacture those discs. And I don't mean just by doing surgery money. I mean they're getting consulting fees, they're getting development fees, they're getting whatever, IP, intellectual property, licensing fees, whatever. The point is these companies bribe surgeons to put their artificial discs in. And they bribe them illegally, but they do it in an illegal way, okay? It's kind of like the President of the United States. They help companies like, let's just pick a company, Halliburton, okay? Let's pretend I'm, say, George Bush, okay? I'll just be George Bush. And let's just say there's this company called Halliburton, and they make all kinds of stuff for war. So they come to me and secretly and say, listen, if you can start a war somewhere in the Middle East, we'll do all the supplying and the taxpayers will pay for it. We'll make trillions of dollars. And when you're done with your presidency, we'll hire you and make sure our friend companies hire you to come and give talks. And every time you come and give a talk for an hour, we'll pay you $1 million. Okay? But you got to make the war happen first. And we got to get rich first off the American taxpayers. So then Bush, if I was Bush, I would say, if I was Bush, not Dr. Deukmejian, I would say, wonderful idea. And so then I would say, look, Iraq has weapons of mass destruction. That's what my intel tells me. But then we got to go to war. And guess who's supplying our troops with the $50 hamburgers, cheeseburgers, right? And the overpriced everything. So then Halliburton supplies as the supplier. And by the way, I would want to make sure that Halliburton had a no-bid contract. You guys know what a no-bid contract means?
Can't compete, no
It means no other company will come in and compete and give a lower price. So the only way to do that is to suddenly go to war, and suddenly we need Halliburton, and we can't put it out for bidding. And guess what? I would suddenly go to war, and I would let Halliburton be the sole supplier, and everybody goes through them, and they supply the government, all the military stuff. And Halliburton would make trillions of dollars, which they did, by the way. And I would be paid, when I'm done, I would be paid to come give talks for $1 million a night. Okay, I don't know if you're following me anymore, but that's corrupt. That's, to me, it should be illegal, but it's not. It's legal.
conflict of interest.
And it happens all the time. It happened with Bill Clinton. It happened with George Bush. I don't know if it happened with Trump or not. I'm not really trying to be political here. I'm just saying it happens with both sides. It happens with both sides, Republicans and Democrats, okay? And it's corruption, and it's happening all the time in our government. So big companies pay off politicians in ways that the American public is relatively unaware of, okay? And it's corruption. So the same thing's happening in the spine world. And that's why it's called the spinal industrial complex. People laugh about it, but that's what we call it, the spinal industrial complex. Because the big companies making billions of dollars selling these plates and cages and artificial discs, well, they're making billions of dollars by paying off a few select surgeons. There's an old saying, 10% of the surgeons do 90% of the work, and it's absolutely true. There are some very busy surgeons out there. And if you go to the companies and say, hey, I'm going to make you millions of dollars by the hospital paying your implant bills for my surgeries, I want something in return, okay? And they're going to give you something in return. And you just trust me. You go to see these meetings of neurosurgeons giving talks at the national meetings. They're all funded by these implant companies, okay? And they're all on the take. Look at their disclosures. They literally have millions of dollars they're disclosing. So some of my colleague neurosurgeons literally get paid $20 million a year for making sure that a company's implants are being put in at a university where they do a lot of spine surgery. Okay? It's extremely corrupt. It's happening every day. We're done. Sorry. And I'm not part of it. I don't do it. I don't think it's ethical. Now, if a surgeon's being paid fairly and they're doing what's right for the patient, that what's in the patient's best interest, then okay. But when you're just bribing surgeons to put artificial discs in and fusion stuff in, okay, just because you're getting money to do that, but it's not best for the patient, then that's wrong. That's where I draw the line. If it's the best for the patient, then do it. If it's not the best for the patient, don't do it. It's that simple. And for me, that's my sniff test, okay, for everybody. Unfortunately, that's not the case for my colleagues. My colleagues are totally corrupted, and I have no respect for those people. So that's why I do my own thing. What's best for the patients? I've been doing it for 16 years. we are done. I'll take questions. Feel free to type them up, and I'll come answer them for you. For those of you wondering why am I so controversial, I'm sorry, that's the way God made me. But I hope you enjoyed the broadcast and learned something. I'm going to show you the 2 incisions. Each one is 4 millimeters. By the way, this patient is a local. I think he's around 30 minutes away, living over on the beach side. And we don't get a lot of locals. We get a lot of out-of-towners, people that travel from other countries, other states, because they don't want what their surgeons are offering them, basically fusions and artificial discs. All right, so I'm going to show you, let's get a light on. So we made 2 incisions, one at 6-7, one at 4-5. And look, right there is a little piece of herniated disc. You see that?
Yes, we do.
All right. So the incision, if you can see this, is literally, can you see that?
Yes, we do.
I made it a little too big today. I made it 5 millimeters instead of 4 millimeters. So an extra millimeter. And there's a piece of herniation. That's what they look like right there, that blue thing. Okay? And there's lots of them laying around because they float out of the tube. Here's another one. Okay, here's a white one. And here's a blue one. Pretty cool, huh? See those? No, don't.
Yes, we
just
do.
leave them. So the white one has more scar tissue. The blue one has more of the degenerated nucleus pulposus. All right, let's go ahead and show one of our patients who had the surgery recently, and I'll come answer your questions. So feel free to type up questions so I can answer them for you. Good morning, I'm Dr. Dumajian. It's December 9, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he is suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes,
as a matter
sir.
of fact.
Yes, doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, doc. You know, I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, you know, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now in my back, and Dr. Dukes is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can
Yes, sir.
actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, doc.
100%.
I mean, 100%. And I mean, the doctor did. They did surgery on 3 different levels, and through a really small hole.
4 millimeters.
Yes,
4
doc.
millimeters. Incredible.
There's no stitches. It's just a Band-Aid.
Yeah.
You know, that's crazy. You know, if you have a fusion for three level fusion, I don't know how long that would be, but it's
it's
terrible.
about that long
Yeah.
for a 3-level fusion. And then of course you'll have swallowing trouble for months,
Not
and
good.
then you'll have pain, and you'll be on narcotics. Are you on any opioids or narcotics?
No, doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Duke laser disc repair, you don't have to worry about getting addicted to painkillers because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know and my 10 younger brothers and sisters, if you're watching this, if you have back issues, you need to come see Dr. Duke, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. It's just do your research. Go to his dukespine.com, look at his website, and just do your research and give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay, thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yeah.
Good morning, I'm Dr. R. Duke Majan, CEO and founder of the Duke Spine Institute, here with one of my patients who traveled from Mississippi,
Yes, sir. Oxford, Mississippi.
which I've never been to Oxford, Mississippi, but I'm sure it's a lovely place.
Very nice.
And why did you come to Duke Spine Institute here in Florida?
I'm having issues with my lower back, shooting a pain all the way down towards my elbow, as well as having a little bit of stumbling while I'm walking within my left leg. And went to other physicians to look at my spine, whatever, and they wanted to do fusion and all kinds of other nonsense that I thought maybe there might be a simpler way, a process of doing things. Did a lot of research and found Dr. Duke here.
And what do we do for you?
You guys did a C3, I think 3-4-4-5, 5-6, like the Duke laser disc repair surgery.
And before surgery, you had neck pain?
Correct.
For how long?
It's been ongoing probably for about 5 years.
And then pain going from your neck into your right shoulder, down your right arm?
Correct, just getting progressively worse. And that's kind of what made me finally to say I got to definitely do something about it.
Here we are less than 24 hours after your surgery, the Duke laser disc repair. You can see the incision right here, it's 4 millimeters. And do you still have that neck pain and pain in your arm?
No, sir. Zero pain.
Gone.
Gone. Completely gone.
Cured.
In shock. Results better than I actually anticipated, which is a good thing, right? That's what I'm here for.
Well, I'm not shocked. It's what we expect to see typically, which is good. The procedure works, and that's why we do it. It works better than anything else. Were you offered any other treatments?
Yeah, they wanted me to go look at a, what do they call a spinal deformity doctor.
Uh-huh.
And they possibly looked at like doing rods and pins and,
Yep.
and all that kind of good, the fusion and everything. So it just kind of,
Why didn't you want to do the fusion option?
long time recovery time and just more of a difficult surgery.
Yeah.
Much more difficult surgery. And me working in a house, I still want to have good quality of life in the future.
Yeah. Well, fusions have complications, a lot of complications. Scar tissue, bleeding, and pain. Are you having any pain right now from the surgery?
No, not at all. Just a little stiffness when I turn left to right, but that's par for the course.
Yeah, the stiffness is going to take some time to work out.
Sure.
You've had bad arthritis in your neck. Your discs were degenerated. You had degenerative disc disease and herniations and bone spur at C3-4, C4-5, C5-6. We went in and fixed all three. You will need therapy to increase the range of motion. It'll take time and you'll get better. Are you happy with your decision to come to Duke Spine Institute?
Very happy. I flew all the way down here from Oxford.
Yeah, very good.
So absolutely made the long trip. I fly back Saturday. And I feel much better flying on the plane than I did earlier. Just thinking, I'm not on any kind of pain medication, none of the muscle relaxant. There's zero pain, so I feel more comfortable hopping on that plane.
And we did it all through a 4 millimeter incision. You could actually see the incision with the little tube going in to your discs. I moved the tube from one disc to the next, and we went back to the back of the disc where the tear was, and I cleaned the tears up with the laser. So that usually does the trick of getting rid of the neck pain when it comes from a herniated disc. And of course, we unpinched the nerve roots that were going down your arm. So that's why your arm is feeling better as well. I don't expect any of that to come back. You should be pain-free the rest of your life. Just don't re-injure the discs.
Absolutely. I'm definitely glad to get my quality of life back. That's the number one thing.
Anything you want to tell your audience?
Anybody that's dealing with the same issues I have, I definitely recommend to come to the Duke Institute of laser surgery. It's a wonderful thing.
All right. Well, congratulations.
Thank you
Safe
so much. I
travels
appreciate
to
it. Thank you so
Dad.
much.
And
We will.
Yeah.
Well, my dad lives in Tampa, so my wife's up there in Oxford taking care of her stuff up there. So
Okay.
Worked out good to have my dad here to pick me up and drop me off at the airport tomorrow.
All right. Sounds good. Well, safe travels for you then.
Thank you so much. I sure appreciate it.
My pleasure.
What a testimonial. That patient obviously very happy with the results of his laser surgery that he had done. And we have a lot of questions, so I'm going to get to them. I'm Dr. Duke Majan. I just came out of the operating room. You were with me in the operating room for this 2-level cervical Duke laser disc repair. And just to give you an idea, the patient's face was looking up at the camera, kind of like I'm looking at you, and the patient had a tube in their mouth like that, okay? The tube going in the lungs, coming off the corner of the mouth, all covered so you couldn't see it. And then their neck was like this, so we could see the middle of the neck, and I went in on the left side. I made 2 little marks, quite literally, just tiny little holes, and we did the endoscopic surgery through those 2 little holes on the left side of the neck. Once again, for those of you who follow me, if somebody has herniated disc, they got neck pain, but they've also got arm symptoms, like on their right arm, I'm going to go on the left side because it's just a little easier to get across the disc, across the back, to get to the opposite side. If this patient had more left arm symptoms, I would have gone on the right side. So that's what I use. Now, if somebody's had prior surgery, like an ACDF fusion, for example, if they've had another surgeon put a metal plate in their neck and cages, and that surgeon, let's say, went on the right side of the neck, I would go on the left side, just because there's so much scar tissue here that you're at risk for damaging something like the arteries or veins. So I would go on the opposite, the virgin, we call it the virgin side. No offense to anybody who's not a virgin, obviously, but that's what we call it, the virgin side. All right, let's get into our questions.
Yes. First question comes from Salamala on YouTube.
Wonderful.
And they ask, is the herniation tinted blue?
Great question, Salamala. Welcome to our live stream. Is the herniation tinted blue? The answer is yes. It's tinted blue because we injected a blue dye. If you remember back at the beginning, I put the needles in and then I injected a little bit of dye into the disc. There was really 2 dyes in there. One was the blue dye, which binds to the herniation and lets me see it nicely, and you as well, obviously. The second dye is called Omnipaque, and it's basically a dye that wherever it is, if you shoot an X-ray through it, it'll block the X-ray. So what you'll see on the other side is blackness, and that's why if you look at those original discogram views, you're going to see black inside the disc on the X-ray. It's not really black, it's just that that's a iodine-based dye, and when the X-rays hit it, it causes a scatter effect to the X-ray. The X-rays don't pass through it, and so basically it's blocking the X-rays from making it out to the detector, which is on the other side. We have a detector panel here picking up the X-rays. So darker things on the detector, which you see on your image, mean the X-rays are not passing through it. That means they're denser or radio resistant. So anyway, the dye shows me the tear on the X-ray and the herniation. The blue dye shows me the actual nucleus pulposus part of the herniation. Great observation.
Next question comes from Sarah on YouTube.
Oh, one more thing. Since we're talking about the dye and the herniations, what we're seeing, folks, let me see how I can present this to you. We have a special model here made for Duke Spine. It was designed by me, and a friend in Canada made it. But if you look carefully through this clear view, you can see in the back of the disc right here is a tear in the wall. And then same thing on the other side right there. Those red lines are annular tears. We literally put the tube in and went to the back there, and I docked the tube right there and cleaned out the tear. So what you were seeing, that blue stuff in between the annular tear, is the nucleus pulposus.
Next question comes from Sarah on YouTube asking, do you take Medicare?
Hi Sarah on YouTube, do we take Medicare at Duke Spine? The answer is yes, we do. However, understand that Medicare does not cover all treatments that doctors do. Medicare has been cutting their benefits over the last 20 years significantly. They're making it harder and harder for people to get the medical care they need. Medicare, just so you know, is controlled by insurance companies like Blue Cross, Blue Shield, Cigna, United Healthcare. Medicare does not manage its own benefits anymore. It has hired Medicare administrative companies called MACs, and in Florida, the MAC is First Coast Services. First Coast Services is Blue Cross Blue Shield. It's a wolf disguised as a sheep, and they're in charge of your benefits. So Blue Cross gets paid money by Medicare, our government, for every denial they do. So every dollar that Blue Cross as First Coast Services saves Medicare by not paying for things, they get a percentage of that money. Okay? I'm going on record saying that because it's true. You see, the insurance companies went to our government around 30 years ago and said, hey, we'll save Medicare money. And the government said, how are you going to do that? And they said, we'll take over deciding what's covered or not covered. It's called managing your benefits. And the government said, okay, well, I don't know. And Blue Cross said, hey, we promise we'll do that. We'll save you money. And the government said, I don't know. And Blue Cross said, I'll tell you what, we will take a percentage of every dollar we save you. That's the only way we get paid, if we save you $1. And Medicare said, that sounds good to me, without actually realizing that's like the fox saying, we'll take care of your hens. We'll make sure that no hen goes hungry, right? Well, of course, if a hen starts getting hungry, the fox eats it. And then there's no more hungry hen. There's no more hen at all. So these insurance companies have snuck in to the back door, unbeknownst to the American public. They're managing Medicare benefits and they're denying payment. So to answer your question, Medicare doesn't pay for everything, but it's no surprise they don't pay for everything, because somebody, the person in charge of deciding what they pay for, is getting paid for them not to cover everything. Sorry. Hate to be the bearer of bad news.
Next one, this is, I believe, a comment or seeking for advice. This comes from Shelly on YouTube, and they said...
Hi, Shelly on YouTube. Welcome to our live stream.
You said, I just had an anterior cervical discectomy and a fusion 3 weeks ago. I can hardly talk, and my voice is hoarse. The plate hurts and is still as much pain I had before the surgery, and I wish I didn't do it.
Yeah, so Shelley, you are one of millions of people having unnecessary spine surgery like a fusion that doesn't work. And I'm so sorry. Here's what I'd recommend. If you're having so much trouble swallowing and you can't talk, that's because of all the swelling and damage done from the surgery to your soft tissues in there. Okay? My advice is let your surgeon know, and if your surgeon doesn't do anything for you, go see an ear, nose, and throat doctor, ENT, ear, nose, and throat. Tell them about it. They may want to get an MRI test, but you can usually start some steroids that will help reduce that swelling and inflammation, and that will make you feel better. But I'm telling you, your doctor may have also poked a hole in your esophagus, and that's very common with incompetent spine surgeons. There's lots of them out there. So if they poked a hole in your esophagus, your swallowing tube, that means food is leaking out into the soft tissues, causing inflammation and pain. That's something I would be very concerned about. The way you figure that out is you go to an ear, nose, and throat doctor. They're going to do a swallow study with barium. It'll leak out through the holes. You'll see it on the x-ray pictures. And then they're going to put you on NPO, no food, for about a month or two, and put a feeding tube in for a little while. Look, folks, no joke. This is why I hate these surgeons for doing these surgeries that you don't need, that are harmful and damaging to you. Come do the laser surgery. I know you may be thinking, oh, it's expensive, I don't know, but you know what's expensive? Dying and not having a life is expensive. Having miserable suffering after your surgery is expensive. I would say one more thing. Once you clear up the swallowing problem from your surgery, come see me. We'll fix your neck pain. Very easy to do. Clearly your surgeon missed the diagnosis, Did not fix everything causing pain. Common problem. A lot of surgeons, spine surgeons, they want to fix one disc at a time. You may have three that are causing symptoms. They're only going to do the worst one. They're going to tell you, oh, we may have to come back in another year or two and do another one. It's a common line. I hear it all the time. It's just nonsense. At Duke Spine, we fix everything with one surgery. The only time we have patients with stuff that pops up after surgery, we didn't know about it ahead of time, is because not all pain is evident at the time you're in the clinic being evaluated and planning the surgery. So there is a small number of people who end up with facet joint pain or some other disc, which is very rare. As long as you make the right diagnosis before surgery, you plan the right treatment. So I'm sorry you're suffering. We can definitely help you, but first thing you need to do is make sure that surgeon didn't put holes in your swallowing tube. Go see an ear, nose, and throat doctor.
Next question comes from John on Facebook. And they said, are people able to have insurance pay for your procedures coming from out of town?
So John, are people able to get their insurance to pay for the surgery if they're coming from out of town? The answer is yes, you can. We do have challenges getting the insurance to pay for all the surgeries. A lot of the insurances don't want to cover the laser surgery because it's so effective and it's so minimally invasive. And that just means more people will want it. And they don't want you guys having surgery at all. Surgery is expensive for them. And every time they're paying for another surgery, they're losing their profits. If you notice, United Healthcare Group is posting record profits right now. Why? Because they're not paying for things. My wife and I went for surgery the other day. She paid $14,000. She has United Healthcare. We went to an in-network hospital. It was a minor procedure. It took 30 minutes to do. $14,000 was our payment out of pocket. And I thought we had good insurance. Well, what good insurance means, what these insurance companies are doing, folks, I got news for you, is they are not paying your bills. If you go look at your explanation of benefits that you get in the mail, it'll literally show doctor charged $250, patient paid $90, insurance paid $5. That's what we've gotten, okay, on her office visit. So we're paying $90, the insurance is paying $5. How does that make sense? We pay a lot of money for insurance. We went to an in-network doctor at an in-network hospital. Why are we paying so much money? The answer is because they're getting away with it. Because you are letting them get away with it, folks. You are letting them get away with it. You're the one paying for the product. You're the one who has the ability to say, fuck off, United Healthcare, pay my bill. The way you do it, you go to your politicians in your state and you say, I will not elect you, politician, unless you write laws that don't let the insurance companies not pay for my medical care. But you guys haven't done that. You see, I'm one person, I have one vote. Politicians are driven by votes. They lie to you, they tell you they're going to take care of you, and then when they're elected, they sell you out. And who do they sell you out for? The big companies, like insurance companies. So you guys have to stand up for your insurance benefits. You have to do a grassroots effort. You have to go and hold your politicians accountable to write laws at the state level that prevent the insurance companies from not paying bills, okay? Right now, the insurance companies are getting out of paying bills left and right, so they don't take it serious. They don't pay the bill. The hospital and doctor get screwed. Hospitals are going out of business. Hospitals are now closing at a record rate across our country. Why? Not enough money. Why? Because the insurance companies are not paying for treatments anymore. They're just denying, okay? You don't believe me? I don't care. Go watch somebody else do surgery. But the reality is, go do your research. You'll learn what I'm telling you is true. Hospitals are closing. Doctors are selling their businesses. They're being consolidated, and they're being now bought up by United Healthcare. Look up something called Optum, O-P-T-U-M, Optum United Healthcare Group. It is the arm of United Healthcare insurance company that is buying up hospitals, doctors, therapists, chiropractors, everybody. And they're basically controlling those doctors and getting them to restrict what they do, okay? Insurance companies are taking over healthcare, and you people are going to get screwed. You're already getting screwed big time, but it's only going to get worse. So you guys have to do something about it. And I'm telling you, from all the research I've done, it comes down to your lawmakers, okay, your politicians. You must demand that they change the state laws in your state so that the states force them, the insurance companies, by the way, force the insurance companies to pay the medical bills for your surgery.
Next question comes from Trisha on YouTube. They asked, how long after the MRI review will I hear from your office with the appointment?
Trisha, how long after the MRI review will you hear from the office? Within a day or two. The MRI reviews we do generally as a free service for people that are hurting, that don't get answers from their doctors. They want to know what's going on. Why am I in so much pain? Is there a way out? The answer is yes, there's a way out. 100%. We can get you out of pain. However, I don't know what's wrong with you until I examine you. So this free MRI review involves a physical exam where I look at you, I have you show me where you're having pain, and I line that up with the MRI findings, and I figure out exactly what needs to be done. We give you a recommendation during the MRI review, and then I pass that same recommendation that I gave you, the patient, over to the scheduling department, and one of our representatives will reach out to you. They'll call you or email you, usually a phone call, and they'll talk to you about getting scheduled. But generally, we can fit you in pretty quickly. Richard, where are you going? Hang out, buddy.
Next.
Speaking of scheduling people, meet Richard.
Hello, everyone.
Rich is a great guy. He's one of our schedulers. So Richard will be the person who reaches out to you.
This one is seeking for advice, and they said, this comes from John on Facebook once more. And they said, I just had a revision from ADR C5-C7 to fusion, 5 weeks out and still a lot of pain. Of course, I am now also worried about disc above and below. Also, lumbar issues now too.
Well, John, thanks for sharing. I'm very sorry to hear that. So John just shared with us that he had in his neck, basically, the surgeon did a 2-level total disc replacement, TDR, artificial disc, it's the same thing. Arthroplasty is another name for it. We have many names in medicine for the same thing. Don't ask me why. It's confusing. But he had these 2 artificial discs put in his neck. They didn't work. And then he ended up having a fusion done, probably because he still had a lot of pain and symptoms. So he had a metal plate put in with little cages. Can you guys see these cages?
Yeah.
Right there on the side?
Yep.
Right. Oh man, it's so hard to do this. Right there and right there. Those are PEEK cages. And your surgeon will either put PEEK in there or titanium. They even could put a cadaver bone. Just depends on what they prefer. I prefer PEEK cages for various reasons. I think they're the best. But, okay, I don't think fusion, I don't recommend fusion at all. So I recommend no cages, no artificial discs, if you can avoid it. John, to answer your question, here's probably what's happening, okay? Your pain is most likely either coming from an adjacent disc, like you said, or it's coming from an adjacent facet joint. So the facet joints, folks, are these little joints in the back of the neck. Let me show you this, okay? And after spine surgery like fusions or artificial discs, the facet joints are the most common cause of pain. Now, look what happens when I move the spine. Keep your eye on the facet joint. See them gliding and moving? You've got a right and you've got a left facet joint. And the facet joints pair up with your disc. So for every disc you've got, there's a disc, you've got 2 facet joints, one on the right, one on the left, okay? So what we really need to do is figure out, is your pain coming from above your fusion or below? That's the first thing I'm gonna do. So if your pain is coming at the base of your neck, then it must be below your fusion. If your pain is coming higher up, above your fusion, then it's probably C4-5 or C3-4-4-5. And we got to determine, is it the disc or the facets? And the way I do that, I have the patient turn their head left, right. If turning your head to the left makes the pain on the left side worse, it's your facet joint. If turning your head to the right makes the pain on the right side worse, it's your facet joint. So I can figure out with a Zoom call, MRI review, which we do for free, and we're happy to do it for you. Why don't you put the link in? I can figure out where your pain's coming from. If it's facet pain, we do a rhizotomy. If it's disc pain, we do the Duke laser disc repair. Okay? I'm sorry you're feeling miserable, and I really wish you the best. Hopefully you'll get in touch with us and let us help you.
Next question comes from Sean, once more on YouTube. And they asked, I wake up with both arms completely numb all the way to my fingertips. Am I too late for surgery to help?
So John says, I wake up with both arms completely numb all the way to the fingertips. So John, step one, we need to know why you're having the numbness in your arms, okay? I know you might think it's from your spine, but it may not be. There's other things that cause numbness, especially when people wake up. The most common is a pinched nerve in your palm, okay? But the palm pinched nerve, it's called carpal tunnel syndrome. It would cause numbness and tingling in these three fingers. It could go up to about mid-forearm, all right? So all through here. If your numbness is going further back up your arm, then it could be a pinched nerve in your elbow right here. It's called ulnar neuropathy at the elbow. And it's a pinched ulnar nerve. That would cause numbness and tingling mostly in these two fingers here, okay? These two fingers and along here. So we need a nerve test. If you have carpal tunnel syndrome, you need the carpal tunnel release. If you have ulnar neuropathy, you need the ulnar nerve release at the elbow. But you need a good doctor to do that. We do that at Duke Spine. If, on the other hand, your nerve test shows there's no pinched nerves in your elbow or your palm, anywhere in your arm, it's coming from your neck, then you definitely need surgery in the neck. My answer to you is this. The fact that you have what are called dynamic symptoms, meaning that they come and go, means there's something ongoing going on, like ongoing compression of a nerve, which is a fixable problem. That's the good news. So I think you have a fixable problem. I just don't know where it is. We would need to do some additional testing to figure it out, but it's very easy to figure out at Duke Spine.
Lastly, this comes from Sarah on YouTube once more, and they asked, I live in Texas. How much does it cost for your surgery? I'm supposed to have an MRI done next week.
Sarah from Texas, thanks for joining us. How much does it cost for the surgery? That's going to depend on several factors. Number one, which disc are we fixing? Is it one disc? Is it two discs? Is it three? Is it four? And is it on both sides or one side? And what part of your spine is it in? Cervical, thoracic, or lumbar? So the cost of the surgery is totally fixed price. It just depends on what part of your spine, how many discs, and which sides we're treating. And we have a fixed price, and we give discounts to people depending on what their insurance and financial situation is. So my advice to you is this. The only way I can give you a quote for a price is for you to do the MRI review, and it's free. You don't have to pay. So once you get your MRI done next week, ask the MRI center for a copy of the MRI images, not the report, the images. There are DICOM files. There'll be several hundred of them. Get that burned onto a CD. Then go to our website, to the mri.dukespine.com, fill out the form with your information, send us the MRI by mail, UPS, FedEx, whatever, not email. And then once Sam gets it, we'll set you up with a 15-minute Zoom block. I will meet you. I'll review your MRI with you, show you where the problems are. I will give you the exact surgery you need done to fix everything. And we will call you that night or the next day with the pricing. That's the way to do it, okay?
I'm gonna need you to move. Thank you. Next questions, we have one is from MMK on YouTube. This one asked, I've had a bad posture, but actively trying to correct it while walking, because this causes my lower back pain to ache painfully after just a few minutes of walking. Do you have any advice on overcoming it?
You're having back pain after a few minutes with walking?
Yes.
The best thing to do, my friend, is to make a diagnosis. We need to know why you're having back pain. And we're not sponsored by Wendy's, but there are certain people who watch these videos who like to see me eat food on the video. I heard it's popular. A lot of people are showing videos of themselves eating food. I don't get it myself, but apparently they have millions of views. So I'm going to see if I can increase my views by having a neurosurgeon who just did spine surgery eat a Wendy's chicken.
Next question comes from Sean once more on YouTube. And I believe this is the last question. And they ask, I had facet joint injections. They did nothing for pain. That doctor suggested burning the nerve endings. Your opinion?
Yeah, Sean, so great question. And just to reiterate what's being said, this viewer says, hey, I had, and I'm going to use the cervical spine. I don't know if this is your lower back or your neck you're talking about, but let's use this one. So the viewer, Sean, had injections around these joints here, okay? These are called the facet joints. And he's saying, I didn't get any better with the injections. Now, understand the injections are temporary. They're just a test. It's kind of like when the dentist puts Novocaine on your tooth to drill a cavity. That Novocaine is going to wear off after a few hours. So while you have the Novocaine there working for you, it's actually numbing up that area. So the idea is that we go in with a needle, numb up these joints. We want to see if it's going to take that pain away. If it does, that means the doctor's in the right place, your facet joints, for your pain. And then they bring you back and they burn the nerves with a radio frequency ablation.
That's for his neck.
Yeah, for your neck. All right, thank you. So here's what I would say. If you did the facet blocks and you got good relief, but it didn't last, it just lasted for like a few minutes or a few hours, then the doctor's probably in the right place. But here's where it gets weird. The insurance company, your insurance company, usually will not approve the radio frequency ablation burning unless you had 60 or 80% improvement with the medial branch block. So something doesn't add up. Either your doctor is lying to the insurance company about your benefits, or you don't remember how much improvement you had, maybe. I don't know. All I can tell you is this. If you want a real diagnosis, come to Duke Spine. All these other doctors, honestly, they don't have any expectation of curing your pain. They're all going to tell you the same thing. We're going to do this, we're going to do that. You're still going to have pain. It's going to come back, but it should help a little bit. Who the hell wants a little bit of help? And who the hell wants temporary pain relief, right? You guys want permanent relief of pain. To get permanent pain relief, the diagnosis must be spot on accurate. And Duke Spine Institute, that's what we do. We do spot on diagnosis. And then you need the most advanced treatment that's permanent. And that's what we have at Duke Spine. With the endoscopic Duke laser disc repair for disc problems and the Duke plasma rhizotomy for facet joint problems. That's it. That's all you need. That's 98% of spine pain right there.
And that is it.
All right. Well, I'm going to go back to eating my Wendy's chicken sandwich. And let's see if I can get millions of views by just sitting here and eating a sandwich in front of you guys.